So I've got this program called the Hip Arthritis Recovery Program, and I've developed it. By the way, my name is Dr. David Midoff, and I'm a manual physical therapist. I'm a specialist physical therapist, and specifically I work in helping people avoid joint replacements, avoid relying on injections and medications so they can get back to being healthy, active, and mobile. And that's the exact goal of the Hip Arthritis Recovery Program. Now, I've helped thousands of people with this program. It's been wildly successful. We've got a bunch of YouTube videos that kind of share parts of the program, principles and ideas from the program. And people are doing parts of the program on their own through our YouTube channel. And we got tons of comments of people saying that they avoided surgery, they're walking again, they're being active again. And then people within our Hip Arthritis Recovery Program, because we get to see them every week. We have live coaching every week. And then we have a community where, like a forum essentially, where they can ask questions and interact with our team there. And they share their wins there all the time. They're making improvements as long as they're applying the ideas from the program, which we've got another section of the program that's just my treatment approach that I've laid out. And I'll walk you through step by step through everything that you would do depending on the phase that you're in, because there's certain things you should be doing at certain times throughout the recovery process in resolving a hip arthritis issue. Anyways, that being said, I think our program is pretty successful, but I want to get some more detailed, objective results on our program, like some hard numbers on how is the pain improving, how active are you becoming, what muscles are activating, because there's certain things that I look at as being successful as kind of milestones in making sure that your hip arthritis is going in the right direction. So we started to do some internal research within our group, within the members of the Hip Arthritis Recovery Program. And I just want to share the initial findings with you. And this is going to be a 12-week look at our program members, and we're doing this by surveys. And I'm going to show you some findings from just the very beginning. And so let me get into it with you guys. In our group, we've got well over 100 people, but there's 21 respondents, and their ages range from 54 years to 77 years old. So they're all people over 50 that have arthritis. Of those people, we have 76.2% that are female, the rest are male. And then they've all seen some sort of healthcare professional. Most have seen a physical therapist. Many have seen their general physician or orthopedist. And then there's some that have seen a chiropractor, and then a range of other people like acupuncturists, massage therapists, and some other specialist physicians. Now, 100% of them said that they did not have a hip surgery in the past. And I asked this because I was thinking maybe some have had a hip replacement on one side and they're looking to avoid a hip replacement on the other side. That's why they're in our program. Or in the past, they've had some other surgery like a hip labrum repair or some like debridement surgery, some other procedure done in their hip, but none have had any surgery as self-reported. Then I asked the question, have you been told by a healthcare professional that you have hip arthritis? So that have they been diagnosed formally? 90% of them said that they have, and then a few, about 5% said no, and then another 5% said that they weren't sure. So that it was a communication breakdown probably. Then of those people that were told that they do have hip arthritis, I wanted to know what stage they were in, because they'll use the Kellgren-Lawrence stage, the staging system, like 0 to 4, 1 to 4, 0 would be normal. And what I found here, if you look at the graph here, it shows that 28.6% didn't remember, so a little over a quarter, but there was 14% that are in stage 4, that's like the worst kind of arthritis. Then we have the biggest chunk, 23%, almost a quarter, were stage 3, then a little under 10% were stage 2, and a little fewer than that were stage 1. So over half of these were staged properly. And then there was a 19% that said that they didn't, they had not been diagnosed formally and told that they have stage 1, 2, 3, or 4. So that big chunk of the people that don't remember, my hunch with those people is that they got a lot of information at that doctor's visit. They probably saw the x-rays or the MRI if they did that, and were just hit by the emotion of, oh, holy moly, I have arthritis, and the doctor may have said or may have not said what stage it was, but either way, it wasn't remembered or it wasn't communicated. But I think that probably that 28.6% is likely a similar split to the over 50% of the people that have stage 1, 2, 3, or 4. Let's move on to the next one. 90% of them have had an x-ray in their hip or an MRI. So they've had, formal imaging done. And then I want to know who's been told that they have bone-on-bone hip arthritis. And just a little under half, 47.6%, have been formally told they have bone-on-bone hip arthritis. And then the next question after that, the natural one, is have they been recommended a hip replacement surgery? What we have so far is 42.9% said yes, I have been recommended a hip replacement surgery. An exact same split said no, and then there's 14.3% that said yes, I have been recommended a hip replacement surgery, but I declined it or delayed it. So it's really over half of our population that we're looking at here that has been recommended hip replacement surgery. Now we get into the physical activity part, and this is really interesting. This is what I'm specifically looking at. The past is just kind of demographics, diagnosis, but now we're going to look at walking. I wanted to know who has been recommended to walk as an exercise to treat their hip arthritis. I thought it was going to be more, surprisingly. It was just 28.6%, which I think is good because I think not everybody should be walking right away. Walking is a common recommendation by healthcare professionals, and I feel like I'm always having to undo this concept of, walking is good for your hip. So I was surprised to find that only 28.6% of our people are saying that they've been told to go walking for exercise, which I think is good. I mean, I would like to see it even less because there's certain milestones that need to be crossed, certain muscles that need to be activated, a little foreshadowing for what's coming up. But then I wanted to ask if you have been told to walk for exercise, has it bothered your hip? And we had 75% say yes, it did. And then the other 25% said no, it didn't bother their hip to go walking. So that's my suspicion, is that people are walking when they shouldn't be because they need to get certain muscles active. Next, I wanted to know if they've been recommended quad strengthening exercises. These are the muscles in the front of the thighs, because I disagree that those muscles should be exercised or strengthened if you have hip arthritis. 61.9% said that they have been recommended to do quad exercises. Then the next question is, did you feel that the quad strengthening exercises caused worse hip pain? And what I got here was very interesting. It's a split between not sure and yes, and then a little bit of no. So 41.2% said yes, they were certain that the quad-based exercises caused hip arthritis to worsen. And then 35.3% said they weren't sure, could possibly contribute. Maybe they were doing other things like walking or different exercises, a variety of exercises. And it was kind of hard to pin it down on the quad-based exercise. That's my suspicion. That's how I look at this. And then there was 23.5% of people that said they're certain that it didn't. So that's good. Next, I wanted to know if you've been recommended by a healthcare professional to do quad-based exercises. 2/3, 66.7% said yes, and 1/3 said no. So healthcare professionals out there are recommending quad-based exercises quite a bit. Next, I want to look at hip flexor exercises because that's commonly recommended along with quad exercises to treat hip arthritis. And 2/3 said that they have done hip flexor exercises. So you're looking like a straight leg raise or a marching type exercise, very commonly done. Then I wanted to know if they thought those exercises were painful for their hip. 58.8% said that they were painful, and then we had a big chunk, 29.4%, that said that they weren't sure, possibly. Could be other things causing their hip to get worse, and just 11.8% said that they didn't think that it was a contributing factor. Nearly done here, 2 more graphs that are good to show. To round out the hip flexor ideas, I want to know how many were recommended by healthcare professionals to do this, and it was 61.9%, similar to the quad-based exercises. So healthcare professionals out there are recommending hip flexor exercises incorrectly, in my opinion. And here's the part that I love to look at. This is my favorite graph here. I asked the question, can you consciously tighten your glute muscles? And there's different situations for that to happen. No one said no, so everyone can consciously activate their glute muscles. It's something that I kind of preach on my channel here. It's very important in my opinion. The biggest chunk here, 2/3 said, yes, I can tighten my glutes, but my thigh muscles begin to compensate if I do too much. That's a compensation. Thigh muscles, like your quads, especially hamstrings, and I would include the hip flexors on the front because of the rectus femoris muscle. It's a specific muscle that's both a quad muscle and a hip flexor muscle. Those muscles tend to overactivate if you don't have enough glute strength. If you can't even activate your glutes, and you're going to dominate using your hip flexors and your quad muscles and your thigh muscles in general. So a lot of people are limited in their ability to do more stuff because the wrong muscles take over. Now let's look at that red section, 14.3%, which combined with the yellow section, that's a little over, it's 81%. That red section means I can tighten my glutes, but the thigh muscles kick in right away. So that means they're very compensated. And every time they go try to do an exercise that's glute focused, if they're not careful, they're going to activate hip flexors and quad muscles, or they're going to be activating the wrong muscles. So those people have a lot of work to do to make sure that they're isolating their glutes as much as possible. It's impossible to fully isolate glutes, but if you can make it the dominant motion, the dominant muscle that's activating throughout a motion where it's supposed to be glute activated, then you're setting yourself up to reduce the bad pressures going through your hip and preserving your hip from getting worse with hip arthritis. And then the final section here is the green section. These are the people that are in a good spot. They can actively tighten their glutes reliably and they don't get too tired. Their thigh muscles don't compensate. That's where you want to be to make sure your hip arthritis isn't worsening over time. We'll be doing more research. We're doing more surveys, weekly surveys. And so I hope to update you real soon with more information about how our program is going, graphs like this, so that if you're on the fence about looking into doing our treatment approach, whether it's just through our free videos on YouTube or doing our free phase 1 that we have available on our website, or even just joining the Hip Arthritis Recovery Program if we have spots available, I want you to know what we're up to and how it's working. So I'm being as transparent as I can be with our results. So I hope to bring you that in the future. In the meantime, though, if you want to just check us out, go check out our free and our paid resources down in the description. We've got tons of stuff out there for people suffering with hip arthritis, because you don't have to suffer. You can make sure that you're treating your hip in a certain way to move in the right direction, away from injections, medications, and of course, an unnecessary surgery.